Hi, I'm Jean Carew, Integrated Care Coordinator from the Outer East Primary Care Partnership. Over the course of these videos, I'm going to show you how you can leverage the tools in the 2019 Mental Health Access and Pathways Report and use human-centred design principles to better understand your clients and develop your models of service delivery to meet their needs. In 2019, the Outer East Primary Care Partnership partnered with Mesh Consultancy on a project to better understand the experience of clients accessing and using the mental health system in Eastern Melbourne. Using input from people with lived experience and service providers in the region, we developed 4 unique client personas: Mel, Rex, Chrissy and Peter. We then created maps of their journeys through the mental health system. These journey maps document the touch points between the personas and a range of service providers. They capture how the person is feeling, how they react, what motivates them, and their attitudes throughout. Critical points along the journey are highlighted and are known as the moments that matter. A comprehensive report that details the personas, their journey maps, and findings was produced. If you don't already have a copy of the report, I encourage you to go to the Outer East Primary Care Partnership website and download a copy of it so you can refer to it during or at the completion of this video. For the next stage of this project, we wanted to demonstrate how the personas and journey maps could be used to understand how changing the way services are delivered can impact important touch points and the moments that matter. We have chosen to use 2 of our personas, Mel and Rex, to do this. We didn't have to look too far to find a scenario to base this demonstration on. The COVID-19 pandemic has dramatically increased the use of mental health services. At the same time, service providers have been restricted in the way they can deliver traditional support, which has driven a significant uptake in the use of telehealth. While many services and clients have embraced telehealth, others are still finding their way or feeling less convinced about its benefits. At the end of this video, I will have demonstrated how you can use the personas and client journey maps in the 2019 Mental Health Project Report to reflect on and redesign new service systems and processes. In addition, because we are focusing on telehealth for the purposes of this demonstration, you have further insights into where and when telehealth could be useful in the journeys of Mel and Rex. Additionally, in order to help guide a successful approach to telehealth, we have also designed some considerations for service providers. For this project, we used human-centred design principles and a 6-stage process. This process could be utilised and adapted to support your organisations in implementing client experience initiatives. To kickstart this process, we spent some time defining telehealth and determining the scope of the user audience. While video conferencing is the main modality people think of when they hear the term telehealth, it actually extends beyond this to include phone interactions, web chat, mobile apps, and social media. We have considered this broader definition for the purposes of the project. We also considered who should be included in the scope and defined it as interactions between client and service provider, as well as interactions between service providers. Interactions between service providers may or may not include the client. Following on from the definition phase, we undertook a brief desktop review of telehealth. We then spoke with a number of service providers to better understand their current use of telehealth. We did this via video conference using short, semi-structured interviews. As the purpose of this project is to demonstrate how to use the existing tools, we didn't conduct client interviews specifically for this project. Rather, we put a telehealth lens over the lived experience data that we had collected from interviews in the 2019 project. However, we acknowledge that gathering further lived experience insights directly related to using telehealth would enhance this process. Using insights from the desktop review and sector consultations, we developed an assessment criteria. We use this to help us understand the possible impacts for mental health clients like Mel and Rex if telehealth options had been used at the various touch points and moments that matter in their journeys. The criteria was then applied to Mel and Rex, considering each individual's circumstances and their overall ability to successfully use telehealth. This helped us identify some opportunities where the introduction of telehealth may be useful in improving the experience for Mel and Rex.